Hey guys, it's Deon with Green Lady, and today I'm here with my friend Dr. Devin Sperra. He is a local emergency physician, and since marijuana has been legalized, it's allowed physicians to take a closer look at this topic. What have you seen in your line of work as a result of this whole new world that's opened up?
I think that alternative medicine has a huge role. You know, it's funny because what is considered medicine in third world countries in China is alternative medicine here simply because it doesn't come in a prescription bottle,
Right.
or, you know, a bubble pack that here's your medicine, take this dose and be gone with you. Herbs and marijuana and the like, there is no cookie cutter type of prescription for it. Health and wellness is important, is preventative, but the sick state is a pathological issue. You are broken and you are sick and something is out of balance, and now health and wellness need something more to get it back in line. The problem lies when there's two ends of the spectrum and that's where you live and you don't choose to meet in the middle. It's all pills in Western medicine and radiology and that only. Don't touch me, don't massage me, don't tell me what to eat, don't put needles in me other than to give me a drug. Western medicine,
Right.
uber alles. And then alternative medicine, your pills do nothing for me and chemotherapy doesn't work and cancer is a state of the mind and that's dangerous and that's bad. You have to be able to meet in the middle and allow both to work together. I think there's definitely room for marijuana CBD use, if for nothing else, to increase your quality of life.
Right.
In particular, things like PTSD,
Yeah.
that's a big one, that your quality of life is shattered for what you've gone through.
Right.
Marijuana, even the Veterans Administration recognizes that that is a helpful adjunct.
Where would you recommend someone start exploring the therapeutic use of cannabis?
Definitely, if you have a physician, it starts with your physician. In particular, if you're already on prescription medications, let them know that is the route you are going. And if you have made that decision, do not allow them to dissuade you. It is important that you do find the proper guidance. It may not always come from your physician. It could come from a myriad of resources, and in fact, likely it's going to. The biggest piece of advice I could say is always do your best to remain objective and weigh out the information. If somebody is offering you a panacea that cures all, it's best to keep on walking. However, if you can find somebody who meets you in an area of belief and understanding that guides you to a positive outcome, that's worth searching for. I know that at Green Lady, they're one of the first to have one of the medically trained bud tenders, and I think that's important. They're the ones who can help guide you gently into this medicine that can start with the slow and low and titrate up. You are not going to get immediate effects. You have to learn your medicine, and that's a big part of what medical marijuana as a whole is. You have to learn your medicine. You have to figure out what works for you, from strains to terpene profiles to THC CBD ratio, which is big. So you got to keep records and you got to understand what it is you're ingesting and then how you ingest it. Everybody smokes, but is that the best way to go? If you're dealing with lung issues, why would you? You know, if you have gastric issues, well, then perhaps eating it would be better, right? And so, yeah, it's going to take a multi-pronged approach. You're probably going to get people who roll their eyes because, unfortunately, marijuana as a whole has been totally ostracized and made evil for so long. And even then, people will not offer that information to me unless I ask. And that's unfortunate because there's no shame in it. And in fact, it shows me that you're taking a vested interest in your own health rather than being and going along for the ride.
Any online resources you would recommend?
I like Project CBD. Project CBD just kind of spells it out for you. There's a lot of good information out there. anymore these days, you could go to just PubMed. PubMed.com is a clearinghouse for medical studies, and you can do a search for CBD and you will get the studies that have been run for things like epilepsy, cancer, all sorts of things. And so then you can get unbiased opinions and information.
That's great. Well, Devin, thank you so much for being with us today. You have given us a wealth of knowledge, and it's so awesome to hear from your personal experience
Thank you.
about this topic. We definitely need more educated minds talking around this subject. So we really appreciate you being here today.
My pleasure. Thank you for having me.
Yeah.